Hello, my name is Dr. Christian Hudson, and I've been asked to speak to you about implementation today. Let's get into it. So, implementation, it's a big topic. I've got 15 minutes, so I'm going to try and cover what I think you're going to find useful. I work a lot with the Applied Research Collaboration, Yorkshire and Humber. I'm the implementation specialist there. So that means I really do spend a lot of time thinking how we can use implementation science and theories, models, frameworks around implementation, and how I can use those to support projects that are going on within the ARC. I was thinking, what can I talk to you about? Well, I thought the best thing maybe would just be to share with you what have I learned as an implementation specialist working in an ARC for the past few years. I think when I do that now, I'll also probably cover a little bit about what's implementation science, what can it offer, and also I want to just touch on where do I think we can go next. So to start with, really, I want to share with you one of the first implementation research studies I ever did. And this was for my PhD about 10 years ago now. And at the time, there was a lot of big lottery money being made available for different places in the UK to implement things to help young people with their mental health. And Cumbria had been given £1 million to implement mindfulness meditation in schools. So when I spoke to this research team and we agreed I would do my PhD around what they were trying to do, I'd looked at some of the historical data on implementation. I could see that generally, whenever we try and implement something into practice, it tends to have about a 10% success rate. So we were planning on putting mindfulness in 320 schools, and I knew that about 32 would probably adopt it, integrate it, sustain it properly, which would then benefit the pupils, but the rest probably wouldn't. So then I thought, well, okay, what can I do for the next 3 years in this PhD? Well, maybe I can try and understand how to increase that 10%. How can we get better outcomes with implementation? And this, of course, is really important because people can't benefit from things that they can't receive. And we have loads of things out there, whether it's medical technologies, medical interventions, things developed out in the community. They've all been shown to be beneficial. There's evidence for them, but they're very hard to get into practice, and people just won't benefit if they're not. So we need a delivery system. It's a bit like the needle in the syringe, and implementation science supposedly holds the key to that. So one of the studies I did, I thought, I wanted to speak to some of these schools and try and understand what things seem to impact implementation. Right? So I chose 5 schools. I really spoke to them at 2 different time points, 6 months apart. And it was anything from 2 to 5 people in each school, head teachers, assistant teachers, head of years, teaching assistants. So I had about 30 interviews. I explored their experiences around implementing mindfulness, and I coded this with the Consolidated Framework for Implementation Research. Now, one thing that you'll know, I'll be showing you in a minute about implementation science, is that one of the things it's produced over the last 2 decades is lots of theories, models, and frameworks. And one of those is the Consolidated Framework for Implementation Research. And it really helps us diagnose contexts, and we can identify barriers, facilitators. It's one of the most used frameworks in the science. So I was very excited to use this at the time, never used it before. So I spoke to all these people at the schools, recorded what they said, asked them questions about implementation, went away, looked at what they said, and coded it using this very thorough and detailed implementation framework. And this is really what they perceive to be barriers, what they perceive to be facilitators in their case. So what did I find from this work? Well, I found a number of factors that affected implementation and distinguished between schools that performed well and schools that didn't perform so well in terms of implementation. So the schools that implemented this well tended to have really good leadership engagement, really good networks and communications. They're able to keep mindfulness a priority and its implementation a priority over time. People generally had positive knowledge and beliefs around the intervention. The schools that did well also had, people in a position of authority really driving the implementation. So if it wasn't the head teacher, it was a head of year 7 or head of year 9, this kind of thing. The schools that performed less well, they would have had maybe a teaching assistant, and those people would come up against barriers and not be able to do much about them. And so, I was really chuffed. I thought, well, I've worked out what drives the implementation of mindfulness in schools, what distinguishes between schools that implement well and schools that don't implement well. And so knowing that, I did what a lot of, budding researchers tend to do. I put together, an implementation plan. I thought, well, if I put this together for schools and give it to schools, then they're all going to start implementing this better. Unfortunately, that wasn't the case. So, and this is a very important point. So if you look at this is my implementation plan. It's very logical. It's very linear. It's very step by step. It all makes sense. It's based on data. It's evidence based. It's based on what they told me. So get the foundations in place, ensure ongoing leadership engagement, involve key people in choosing which mindfulness program you're going to use, develop and sustain an implementation team, ensure sufficient result, etc., etc. Now, if you look in the implementation science literature, you will see thousands of papers like this, making these recommendations. They've analyzed the problem of implementation, and then they make recommendations of what everyone should do. Why didn't this help the schools? Well, firstly, it's based on something in the past. It's frozen in time. These findings are based on 5 schools, 5 contexts in the past. Future sites, future schools are a different context. Contexts are ever changing. They're not fixed. And so those contexts will have different problems, different barriers. So leadership engagement, generally, you do see it across contexts, and it is always going to be an important factor. But there's another issue. So even if perhaps some of these things aren't so frozen in time and they do apply to future sites, which is fair enough, you could argue that, there is another factor here, which is that I can say to someone, well, ensure ongoing leadership, but the person in that sort of setting has to then go, well, which leaders? How often do I meet them? Where do I meet them? Involve key people. Which key people? Develop and sustain an implementation team. What's that? How do I do that? Ensure sufficient resources are available. Well, that's pretty hard for me. I don't really have control over that. Make mindfulness a priority. Well, we've got GCSEs, we've got A levels, we've got this, we've got that, we've got to do toothbrushing. So this is where we're getting into the reality. There's you can see here how I started to realize that the science of implementation had spent the last 2 decades really proving itself as a science and developing lots and lots of theory around implementation. So there's now over 170 theories, models, and frameworks for it. But we've kind of neglected the practical aspect. And so I kind of went on a bit of a journey. I actually started an implementation science podcast, and I started talking to people around the world. I wanted to find out, what can we do? Because I wanted to know, how can we have research that actually has an impact? Because I'd done all this work and it wasn't having the impact that I wanted it to have. And what I found, so I spoke to, some leading implementation scientists in America. I spoke to a climate change professor. I spoke to an ICU consultant. I spoke to school teachers. I spoke to lots of different people with experience of implementation, all trying to find out, how can we do implementation research that has an impact? And what I discovered was that the science has been brilliant up to this point, but it also has limitations. So in terms of defining implementation, we've been brilliant at that. Categorizing the different aspects of it, brilliant. There's models that show you the stages of implementation. There's determinant frameworks that show you all the different things that affect implementation. There's process models that sort of lay it out, like this is how you might want to think about it. And there's ways of evaluating. There's a common language now across research studies. We've raised a lot of awareness about the importance of implementation. We're brilliant at evaluation. I can, like I did with those schools, I followed their implementation journey and was able to say how well they'd implemented. I was able to say what the barriers and facilitators were. So it's very good at evaluation. We can really good at telling you what went wrong. We've also spent a lot of time trying to create strategies and testing strategies. So you make, things like education and training, organizational changes, audit and feedback. And we've been sort of looking at those and seeing how do they link to implementation outcomes like adoption, sustainment, penetration, acceptability, feasibility. So there's a whole list of strategies that you can try. So these are all the good things about implementation science in a way and what it can do. But look, this is the science came around in mid 90s, early 2000s because of, we weren't getting things into practice. And it really set out to achieve kind of 3 main things. It wanted to understand, how can we get people to adopt things? So decide to take things up. How can we get people to implement things? And how can things be sustained? And then how can that then lead to impact? So it really is, as this definition says, the study of methods to promote the adoption and integration of evidence-based practices, interventions, and policies into routine healthcare and public health settings to improve the impact on population health. But has it achieved this? Well, I don't think it kind of has. I think that's still a question. A lot of implementation scientists can't really tell you how to ensure adoption, integration, and impact. So that's something that we're still trying to figure out. So, and there's 2 reasons for this, I think, 2 main reasons for this. Firstly, we've tended to be quite disconnected from practice. And so, if you look at a lot of universities and research centers, they tend to be quite removed from practical settings like hospitals and schools and communities. And they kind of generate this theoretical knowledge, academic knowledge, and then sort of feed it into these settings, give it to these settings. And it's still left to the settings to work out how to implement it. And so that disconnection has led to various issues. Like a lot of our findings don't get into practice. And a lot of what we do isn't informed by practice. So the outcomes we look at, the methods we use. We've also tended to ignore complexity or kind of just not really work with it very well. And this is a big topic area, but really what it means is that we're implementing into complex settings. And that means that they're unpredictable. So basically, when you're implementing something, we don't really know what the problems will be till we start. We don't really know how it's going to go. And as we go through that process, loads of things will happen, loads of learning will happen, loads of workarounds will come up. People have to be creative. They'll have to come up with new ideas, have to muddle through all these problems, have to optimize, adapt, learn. There's this whole process of learning that goes on in practical settings. And so this idea that we can implement kind of the same way everywhere or use the same strategy everywhere, it just, isn't tenable. And actually, when you really delve into the complexity of implementation, what that means, it's a social process. It's not a linear step-by-step mechanistic complicated thing. It's a complex social process. It's unpredictable. So we've got to use research methods that can deal with that and that acknowledge that. So I think that's why we still haven't really solved this problem of adoption, integration, sustainment, and impact, because we've been disconnected from practice and we've ignored complexity. So what have I been doing in the face of all this, my experiences and what I found out? Well, firstly, the traditional approach to research and the gold standard has often been randomized controlled trials. But what's become clear to me is that trials are useful at the early stage of research. So if you're just checking if something's feasible and you want to do a bit of implementation on top of that, fine, you can do a trial. But if you really want to understand how to implement something, case study approaches, I think, probably more useful. The thing about trials is we control a lot of the contextual factors that get in the way of implementation. So it's not really, say, like a very realistic environment in a way. And learnings we get from trials tend to be based on the trials. And again, not that applicable to future sites. So we need transportable knowledge. We need practical implementation knowledge. So what's case study approach? We will have something that maybe it's evidence-based, maybe it's just an idea, maybe it's something that we're developing with these sites, but we'll say, look, we want you to try and implement this. And as you try and implement it, we want to capture all the juicy practical learning and knowledge that you come up with as you're trying to implement it. We like to call that within system learning. And we try and capture that in quite clever ways. And you see, the more case studies that then you do and the more of this practical knowledge you get, you would hope that you'd have something that's externally valid, so that can be applied to future sites, some key principles, key ideas of how to implement, right? So that's one thing. And we also recently have started doing these kind of real-time complexity analysis with sites. So example of this is virtual pediatric wards. So it's a couple of sites I'm working with. One treats young people with cancer, one treats young people with diabetes. And instead of dragging them into hospital regularly to get their checkups and stuff, they're using this technology to treat them at home, and they wanted to evaluate it. And really, I'm talking about evolving how we do research here, in that my role as a researcher in this case is not just to kind of extract data from what they're doing and then at the end tell them how well they implemented, what the problems were. It's really to help them implement better. So every week we'll be keeping in contact with these teams on the front line as they try and implement pediatric virtual wards, and actually working with them to identify where is the complexity in their health system when implementing it. Is it the condition? Is that simple, complicated, or complex? Is it the value proposition? Is it the actual organization itself? Is it what people think about this technology? And where we identify complexity, we can then try and reduce it. If we can't reduce it, we'll try and run with it. Now, you might think, well, what does all this mean? Well, I don't have time to go into it, obviously, in detail now, but the more complex something is, the less likely it is to ever be implemented. So by working with sites to reduce complexity, we're increasing the chance of it being implemented, and we're learning an awful lot about how to implement it along the way. Also, finally, just want to touch on relationships and trust. I mean, this is something we all know matters. A lot of you will work out in practice. A lot of you will be involved in funding programs or working in practice with programs on the ground. And of course, we all know how important relationships are, but this tends to be something that's been kind of ignored by the science. Again, it's not really been researched well, partly because it's so intangible, it's hard to measure. But if you can build trust and relational connections, that will have a huge impact on your implementation outcomes. So we need to study that more as well. So really what I'm saying is, let's move away from linear models, right? These emphasize knowledge creation and implementation as sequential steps. And we've tended to think about it this way, like we are going to feed knowledge through a pipeline into practice. We are going to implement in a logical way. We'll do this and then this and then this, and we'll follow this strategy and it'll be the same everywhere. This doesn't work because practical settings are just too complex and we've got to deal with that. So what I'm really saying is interactive models are, I think, the way to go. These highlight co-production and iterative engagement between stakeholders. So whatever kind of implementation research I'm doing, I really do try and make sure there is this ongoing interaction where my role as a researcher is to really help them achieve their goals. And in doing so, I learn about implementation. So finally as well, just if we're, like I say, if we're going to solve this, we do need to draw from other sciences. all of us need to start collaborating together, and not just different scientists, but everyone in the system. So I think if implementation researchers, if we can evolve the kind of research we do, the methods we use, the outcomes we focus on, we do more interactive approaches, that's going to help. But we also need all these other stakeholders in the system to probably evolve how they think about implementation and what they do. And we all need to work together to solve this, because implementation, like a lot of things like obesity, poverty, and climate change, is a wicked problem, and it will require an all-out collaborative effort to solve it. Just to finish, a little plug of what we offer. If you are going to be implementing something and you want help, maybe you're designing a project, we can help you integrate implementation science into that. We can help you with designing your implementation studies. We can help evaluate implementation for you. We can train your team in the use of implementation science. So, I train a lot of teams in how to use some of those theories, models, frameworks I spoke about. I train them in what sort of approaches they might use. We do have a new course, actually. It's a 3-day course, and I teach people everything I kind of know about implementation research so they can go away and apply it to what they're doing. So, and we like to keep people up to date. So we do have this podcast I mentioned, the Essential Implementation Podcast. Do check it out. I've got some great interviews on there and some great videos. And so it's been really nice making this video for you all. Sorry I couldn't be there, but I hope to meet you at some point in the future, and all the best. Thank you very much.